Welcome to Module 2. In Module 2, you will learn about infection prevention practices during COVID-19. We will be focusing on hand hygiene, respiratory hygiene, and physical distancing. Hand hygiene. In hand hygiene, we will learn about why it is important to maintain hand hygiene, washing hands with soap and water, and cleaning hands with an alcohol-based hand sanitizer. Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and can make you sick. Therefore, avoid touching your eyes, nose, and mouth before washing your hands with soap and water or cleaning them with an alcohol-based hand sanitizer. Practicing hand hygiene can help prevent the spread of COVID-19. The WHO technique recommends that washing hands with soap and water should take you 20 seconds. Wet your hands and apply enough soap to cover all hand surfaces. Rub hands palm to palm. Then rub right palm over left hand with interlaced fingers and vice versa. Rub palm to palm with fingers interlaced. Rub the backs of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally, left thumb clasp in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse your hands with water and dry them with a towel. Your hands are now safe. It should take you 20 seconds to complete steps 2 to 7. Whether medicated or scented solid or liquid, any kind of soap can be used to wash your hands. Any soap in general is effective in removing viruses like COVID-19 from your hands. Remember to wash your hands after using the toilet, before cooking, before eating food or feeding your child, and after eating food or feeding your child, and most importantly, when they're dirty or visibly soiled. If soap and water are not available, the most effective way to clean your hands is to use an alcohol-based hand sanitizer using the WHO technique. The WHO recommends hand sanitizers containing 75% volume per volume isopropanol or 80% volume per volume ethanol. Do not use an alcohol-based hand sanitizer when your hands are dirty or visibly soiled or after using the toilet. In these cases, hand washing with soap and water is required. As for this technique, hand rubbing should take you between 20 to 30 seconds. Then, follow steps 2 to 7 of the hand washing techniques, same as with soap and water. Whether you use soap and water or an alcohol-based hand sanitizer to clean your hands, both are effective in washing away viruses like COVID-19. Remember, to remove viruses like COVID-19 from your hands, wash them with soap and water or alcohol-based hand sanitizer for 20 seconds. Any kind of soap that produces lather can be used to wash your hands. Wash your hands when they are visibly soiled, after using the toilet, before cooking, before and after eating and feeding others, and after touching public places, objects, and surfaces. Respiratory hygiene. In respiratory hygiene, we will learn about how to cough and sneeze properly, the importance of not spitting just anywhere, wearing masks and face shields. To avoid transmission of viruses like COVID-19, it is essential that all individuals, including healthcare workers, children, caregivers, and family members, follow respiratory hygiene. If you have to cough or sneeze, cover your mouth and nose with a clean tissue. This tissue captures respiratory secretions and must be disposed of in a closed trash can. If you do not have a clean tissue, turn your face into your shoulder or the bend of your elbow to cough or sneeze. Do not spit in public in case you're a carrier of COVID-19. This puts people around you at risk of catching the virus. There are two kinds of masks. Surgical masks, otherwise known as medical masks, should specifically be worn by health workers, people who have COVID-19 symptoms, and those who take care of someone suspected or confirmed with COVID-19. Cloth masks, or non-medical masks, should be worn by people who have no COVID-19 symptoms, but live in areas where the virus is widespread and where physical distancing of 6 feet cannot be achieved. Homemade cloth masks only reduce the chances of inhaling droplets still in the air from an infected person. They do not completely protect you against the virus. If you have prolonged coughing or sneezing, or are suspected to be infected with COVID-19, please wear a surgical or medical mask. Hand hygiene must be practiced before wearing a mask and after removing a mask. The mask captures respiratory secretions like spit or saliva and must be disposed of in a closed trash can. The government now requires everyone stepping out of their homes to wear a face shield on top of a face mask. In public settings, one can never know if another person is infected with COVID-19 or not. The use of this additional barrier will help reduce exposure to and emission of respiratory droplets considerably. Make sure that the face shield you use is a full one which covers the forehead to the chin. So what are the do's and don'ts of wearing a mask? Always wash your hands for 20 seconds before wearing a mask. Avoid touching the external surface of the mask while using it. If the mask is soiled or wet, do not reuse it. While wearing a mask, unfold the pleats of the mask and ensure that they are facing down. Place the mask over the nose, mouth, and chin, and ensure that there are no gaps on the side of the mask. Don't wear the mask under your chin with your nose and mouth exposed. Don't leave your nose or mouth uncovered. Remove the mask only using the strings. After removing the mask, clean your hands with soap and water or use an alcohol-based hand sanitizer. Cloth covers or masks should be washed after every use. If you are using a single-use mask like a surgical or medical mask, remove the mask and discard in a closed trash can. Now, what are the do's and don'ts of wearing a face shield? The face shield must completely cover the face. The panel of your face shield should extend well past the chin and curve around the sides of your face. Wear a face shield with a face mask. Make sure that you have put on the mask properly before putting on the face shield. Avoid touching the outside surface of the face shield. Wear, adjust, and remove it using the ear straps or ear support. Do not lift the face shield and allow it to rest on the top of your head. It should always be covering your face completely. Clean the face shield with a disinfectant solution or rubbing alcohol after use. Remember, cough or sneeze by covering your nose and mouth with a clean tissue or into the bend of your elbow. For prolonged coughing or sneezing, wear a surgical or medical mask. Used tissues or masks may contain the virus, so dispose this appropriately in a closed trash can. Wash your hands also after removing the mask or disposing tissues or masks. In addition to face masks, Filipinos are required to wear a face shield when going out. Make sure that the face shield you use is a full one, which covers the forehead to the chin. Make sure you have properly put on the mask before wearing the face shield. Physical distancing. In physical distancing, we will learn about what physical distancing is, how much distance you should keep, and why is physical distancing important. What is physical distancing? Physical distancing, also called social distancing, is a public health measure that can help reduce the spread of viruses like COVID-19. How much distance should you keep? This means that we keep a distance of at least 6 feet from each other and avoid going to public places unless necessary. Why is physical distancing important? When a person coughs or sneezes, droplets of their spit or saliva can travel up to 6 feet before they land on surfaces or objects. By creating a barrier of 6 feet between yourself and others, you can help stop the spread of the virus. Physical distancing complements measures such as hand hygiene and respiratory hygiene. Avoid the 3 C's: closed spaces, crowded places, and close contact. In this module, we learned about washing hands after touching objects and surfaces, covering your mouth while coughing or sneezing and not spitting in public places, and maintaining a distance of 6 feet from people whenever possible. When these 3 infection prevention measures are followed, it will help prevent the spread and transmission of viruses like COVID-19.